Imagine breaking your leg 5,000 years ago. No hospitals, no anesthesia, no antibiotics, no pain medication, no x-rays, nothing. Yet somehow, humans didn't just survive, they thrived. In fact, ancient humans performed surgery on skulls with crude stone tools, and patients lived. So how did they do it? How did our ancestors cheat death without modern medicine? Stay tuned, because what you're about to learn will make you question everything you know about human resilience. Let's set the scene. You're a hunter-gatherer in ancient times. Life expectancy? Around 30 to 35 years. But here's the thing. That number is misleading. Infant mortality was brutal. Probably 30 to 40% of children didn't survive childhood. But if you made it to adulthood, you had a decent shot at living into your 60s, 70s, even 80s. The ancient world was a gauntlet of dangers. Infections from simple cuts, broken bones, childbirth complications, parasitic diseases, malnutrition, predators, starvation. But humans didn't panic. They adapted. Because here's what modern medicine doesn't teach you. Our ancestors had something we've forgotten. They had instinct, they had observation, they had desperation, which is the best teacher. In 1865, archaeologists discovered something that shocked the scientific community. Skulls, ancient skulls, with holes drilled into them, perfectly symmetrical holes. This procedure, it's called trepanation, and it's one of the oldest surgical procedures in human history, dating back at least 12,000 years. Now, here's the insane part. The patients survived. We know this because the bone around the holes healed. The edges are smooth. These weren't post-mortem procedures. These were living people who had holes drilled into their skulls and lived. Why would they do this? Scientists have theories. Theory 1. Brain pressure relief. Ancient people noticed that headaches, migraines, and mental illness sometimes improved after head trauma. So they thought, if we drill a hole, we release the evil spirits causing the pain. Sounds crazy, right? But here's the thing. It worked for some patients. Probably placebo, but it worked. Theory 2. Treating skull fractures falling from a tree, getting hit in battle. A fractured skull was death without intervention. Ancient surgeons realized that removing bone fragments and cleaning the wound prevented infection. These surgeons used stone tools, no sterilization, no anesthesia. Yet they had a success rate of 50 to 90% depending on the study. Compare that to 18th century European surgery, which had a lower success rate. Why? Because ancient surgeons followed one rule: cleanliness. They used water, they used fire to sterilize tools, they used herbs, and they let wounds drain. Simple, brutal, effective. Pain management. Now, here's the question nobody asks. How did they handle pain? Imagine lying down while someone drills a hole in your skull. What do you take? The answer: plants. Specifically, alkaloid-rich plants. Ancient pain management. Willow bark contains salicin, the precursor to aspirin. Opium poppies contains morphine. Yes, morphine. Datura, powerful hallucinogen that numbs pain. Cannabis, used in China, India, and the Middle East. Alcohol, not subtle, but effective. Archaeological evidence shows that Sumerians were using opium as early as 3400 BC. The Ebers Papyrus from ancient Egypt, 1550 BC, literally prescribes poppy for pain. But here's where it gets dark. Some civilizations used techniques that make your skin crawl. Bloodletting. They drain blood believing it balanced humors. Cold immersion, shock therapy to numb pain. Compression, literally tying down limbs to restrict blood flow. Cauterization, burning wounds to seal them. Brutal? Yes. But it reduced infection rates. Heat kills bacteria. Our ancestors weren't stupid, they were desperate, and desperation breeds innovation. Antibiotics. before antibiotics. Here's something that will blow your mind. Infection was the real killer. Not broken bones, not wounds. Infection. A small cut could kill you if it got infected. Childbirth complications could become life-threatening in days. So how did ancient civilizations prevent this? Answer: they accidentally discovered antibiotics. 1. Honey. Ancient Egyptians used honey on wounds religiously. Why? Honey is naturally antimicrobial. It creates an environment where bacteria can't grow. It literally draws out pus. Modern hospitals are still using honey-based wound dressings too. Mold and fungi. Chinese healers used moldy soybeans on wounds as early as 2,500 years ago. They didn't know why it worked, but it did. The mold was producing natural antibiotics. Sound familiar? Penicillin is a fungus 3. Plant poultices. Garlic contains allicin, a natural antibiotic. Turmeric. Curcumin has antiseptic properties. Tea tree oil, used by Aboriginal Australians. Willow, antimicrobial properties. The genius part? They didn't need to understand germ theory to use antibiotics. They just observed, this plant stops wounds from rotting. Then they used it. Trial and error. Thousands of years of trial and error. This is why the survival rate for injuries was higher than we think. Childbirth and maternal care. Childbirth, the #1 killer of women in ancient times. Infection, hemorrhage, breech presentation, prolonged labor. Modern hospitals reduced maternal mortality from 1 in 10 to 1 in 5,000. That's insane progress. But ancient women didn't just die. Many survived. Here's how. Prenatal care. Midwives, almost always women, observed thousands of pregnancies. They knew which positions helped. They used massage and movement to help positioning. They monitored diet and nutrition. During labor, squatting positions, better than lying down, walking and movement to help progression, herbal drinks to strengthen contractions, emotional support and community presence. After birth, immediate breastfeeding stimulates uterine contractions. Herbal teas for afterbirth expulsion. Rest and isolation from potential infection sources. Monitoring for complications. Were maternal mortality rates high? Absolutely. But the system worked because it was based on thousands of observations by experienced midwives. Some of these practices, like delayed cord clamping and skin-to-skin contact, are now being recommended by modern medicine. Turns out, our ancestors knew something: mental illness and brain disorders. Here's something truly fascinating. How did ancient peoples handle mental illness? Depression, schizophrenia, anxiety, psychosis. Many historians believe trepanation wasn't just for physical injuries. It was also used for psychiatric conditions. And here's the thing, it sometimes worked. Why? We're not entirely sure. Theories include placebo effect, relief from intracranial pressure in some cases, ritual and community support, the herbs they used during the procedure, but ancient civilizations also used ritualistic healing, shamanic ceremonies, community support equals mental health improvement, meditation and breathing techniques, sacred plant medicines, psilocybin, DMT, mescaline, drumming and sound therapy, isolation and reflection. Modern psychology has validated many of these practices. Meditation reduces anxiety, community support prevents depression, psychedelics are being used in modern therapy. Our ancestors didn't have brain scans, but they had instinct and observation.
The dark secret. But here's what modern medicine won't tell you. Survival didn't always mean recovery. Some people recovered, others lived in chronic pain their entire lives. Amputations without anesthesia, infections that never fully healed, parasites living in bodies. Ancient humans didn't just survive. Many of them endured. They developed a psychological resilience that modern humans have lost. In a world without painkillers, people learned to accept pain, to manage it mentally, to continue living despite suffering. That's dark, but it's also profound. because it reveals something about human nature. We are capable of far more than we think. So how did ancient humans survive without medicine? Not luck, not magic, knowledge, observation, desperation, and an iron will to survive.